Congratulations to the class of 19. Now don't get uncomfortable, this is not last year's speech. You Lions of 2020 will no doubt be remembered as the class of COVID-19. This is a title you should wear proudly. The question that I will raise today is, what will you do to become essential in the fight against this pathogen and other pathogenic forces? It will be my claim today that the best way for you to serve, dear Lions of 2020, will be to become or to resume being essential workers. Now, what do I mean by essential workers? I know you've all been reading what were once quaintly known as newspapers, and which you now think of as the phone. There's a lot of disinformation in the media, including social media, but the truth about our current crisis can still be found by reading carefully, by attending to what's happening around you, and by thinking critically about some of the crises that we all face now together. So I'm sure that you've heard the term essential workers, frontline workers, but what really constitutes the essential? What constitutes the front line? These are people we and you should strive to be. And we also should strive to expand our notion of what and who, most importantly, is to be considered an essential worker on the front line. Without this, we will fail on our quest to deliver global health equity. That's your goal, Lions of 2020. And in confronting COVID-19 and other pathogens and pathogenic forces, there's much we can learn from all those who are already today fighting to serve as essential workers. Essential workers include nurses and doctors, of course. Essential workers include vaccinologists and other researchers. Essential workers include public health officials. But essential workers also include, more visibly in these times of crisis, the people who plant our gardens and till them, the people who feed us, the people who have sustained you as you've studied on your beautiful mountaintop or here in this stunning city. The people who pave our roads and move us from one point to another. The people who keep us safe. The people who make things with their hands. Not only our phones, but our clothes and our clinics, our homes and our hospitals. In the United States, many of these essential workers have shouldered extraordinary burdens over the past few months. Many of them have fallen ill with COVID-19, in part because we treat too many workers as sacrificial lambs. And too many of the stricken have perished, not because we have in the United States too little stuff or too few medical staff or safe spaces, but because we lack systems, or because, more importantly, the system itself is unfair and has been since the founding of our republic. It's true that the Republic of Rwanda has done a far better job without all the staff and stuff and space we take for granted in the United States. Yes, we've done better here in Rwanda, in part because of better systems. But, dear Lions, we can still do better. I could give an entire graduation speech about disparities of risk for infection with a newly described pathogen and disparities of risk for poor outcomes once infected. In fact, I have given many graduation speeches about just this topic. These aren't cheerful or celebratory comments and seldom draw much in the way of applause. So I will skip that knowing that no one graduates from UGHE without contemplating and studying the disproportionate risks faced by some, risks from which others are spared. Remember, it's not that essential workers are all brave because they must face undue risks, although many are called to do so. Firefighters know they must go towards the fire. But what is truly essential is that we acknowledge that many essential workers bear burdens that are anything but essential. High risk, poor pay, and worst of all, a lack of acknowledgement. So let's stop for a second and think of our own friends and colleagues, drivers, nursing assistants, cooks, community health workers, EMTs, you know the list. Let me continue by reflecting on two related challenges from two great leaders. Let me pause to acknowledge the passing of Congressman John Lewis, who I was lucky enough to meet more than once. When he was only 19 or so, he embarked on a mission of global health equity. You may know the story, but imagine a society in which he, a young theology student from Alabama, could not sit down at the same table or in the same train car as a white peer. What he felt called to do, his way of doing global health equity, was to make good trouble. Making good trouble led John Lewis to protest not only racial injustice, but every form of injustice. He often fought for proper recognition and acknowledgement of essential workers. This is what he called good trouble. He suffered for it, but it's why he was and is and will be celebrated for a long time to come. Now let us think of our own work here in Rwanda and elsewhere. Work for global health equity as a concept and, of course, in practice, because we know that you're all about the implementation. How do we make good trouble in our own work? Last week, I was in Butaro with UGHE board member Dr. Sinait Fisea and her family. But then, you know that. Because those of you who were on campus came out to give us the most awesome wave. So let me give that back to you. Thank you, Butaro campus. Of course, I teared up a bit looking across the mountain at you so far away, but these were tears of pride and joy. I was even more proud of the work done by our colleagues in the cancer program. Now think, who beyond family are the most essential workers in caring for children and adults with cancer in the midst of a pandemic? Just stop and think about it. In the midst of a shutdown, at a time when we're called to practice social distancing, when all across the world economies are shut down, who took care of those patients? Were they simply forgotten, abandoned? No, they were not. Many of you know the people who run that hospital and its programs. One of them is an administrator named Godfrey. I've known Godfrey for some years and was asking him, along with my colleagues, how are things going for patients from far away? And he told me that whether patients were from Rwanda, as most of them are, or from Burundi, or the DRC, or Uganda, the team there made every effort to find them, to get them their medications, or to bring them close for care. This is a classic example of making good trouble. And without that huge collective of individuals who we are here describing as essential workers, many people would have lost their lives, not by dying of COVID, but by dying because of it. Yes, that is heroic work, but isn't that also good trouble? Doesn't global health equity require the managers, the logisticians, the drivers, the people who prepare the medications and chemo, in addition to those who administer that treatment? We all know that global health equity requires a vast army of essential workers. And that, I hope, is your goal as you graduate today, to join or rejoin that army of essential workers. Let me close by citing another leader who, like John Lewis, has made much good trouble in the course of recent decades. Last week, the president of Rwanda convened a cabinet meeting, and Dr. Senait and I were invited. It was a private, closed cabinet session, so of course I asked permission if I could paraphrase him here today. He might have gathered his team together and his guests and friends to reflect on the success that Rwanda has had in responding to COVID. But that was not his intention, nor was it his message. You know that I live between two nations and am proud to be both an American and a Rwandan. Proud and grateful to have been born and raised in the United States of America. But as my two countries have had a different approach to reconciliation, so too have they had a very different approach to the current crisis caused by a novel coronavirus. I won't go over the grim details, but last month in the United States, we had close to 2 million new cases and many, many deaths. I have lost friends and family to COVID. We can only pray the worst is over, but it doesn't look that way. In order to stem the tide, there and elsewhere, we will have to make more good trouble. Now, Rwanda has had a very different experience so far, and you are no doubt proud. But His Excellency did not call us together to praise either the cabinet or his guests. Instead, he challenged us to do better, drawing special attention to the need to improve hospital services. This requires, of course, all of the essential workers that make a hospital work effectively and safely. Let me echo him here, since we took that message to heart. So yes, continue to focus on equity. And of course that, by definition, requires humility. Equity within your own institutions and between them, within a nation and between nations. This work requires, again, a huge army of essential workers. So let's join that army as proud graduates of UGHE. We're with you, Lions, class of 2020, class of COVID-19, and we love you and are so proud of you. Congratulations to you and to your families. And now, dear Lions, you see this smile creeping over my face? I know there's someone who you've been waiting for, and I get to introduce him. Not only a great friend, but a great teacher. I've already quoted his remarks in my speech, and it's hard not to smile when I think about the line, and now a man who needs no introduction in Rwanda. Ladies and gentlemen, parents, children, kin, proud graduates, I give you His Excellency, Paul Kagame.